This is the fulfillment of a promise that we made in the Maha report. The Maha report, which we released 2.5 months ago, has 120 recommendations for how to transition, how to eliminate the chronic disease epidemic and transition to a healthier America. And among those promises, among the recommendations of the report, was the promise to make it easier for farmers in this country, farmers who are dependent on inputs, on chemical and fertilizer inputs, to give them an off-ramp where they can transition to a model that emphasizes soil health, and with soil health comes nutrient density. I'm very, very happy to have as a partner in this endeavor Brooke Rollins. I've been working on farm issues for 30 years, and this is the first USDA secretary who I believe is really committed. This is the fulfillment of a promise that we made in the Maha report. The Maha report, which we released 2.5 months ago, has 120 recommendations for how to transition, how to eliminate the chronic disease epidemic and transition to a healthier America. And among those promises, among the recommendations of the report, was the promise to make it easier for farmers in this country, to give them an off-ramp. Farmers who are dependent on inputs, on chemical and fertilizer inputs, to give them an off-ramp where they can transition to a model that emphasizes soil health, and with soil health comes nutrient density. And without coercion, through voluntary action, to give them good incentives to do well by doing good for themselves, for our children, and for the country. I'm very, very happy to have as a partner in this endeavor Brooke Rollins. I've been working on farm issues for 30 years, and this is the first USDA secretary who I believe is really committed to giving us, we already have the healthiest food supply in the world, to making a food supply that's even healthier, that's going to sustain, again, a transition to a much healthier America for our children. I also want to thank these farmers who are inspiring, and they're inspiring to the farm community, to all of us who care about good health, about sustainability on the farm, about soil, about water retention, about soil retention, about the health of farmers themselves who are concerned about the health of their children from too many chemicals on the land. And they have given us models. Some of these are 5th, 6th, 7th generation farmers, and they've provided us models for how to do this and how to do it in a way that vertically integrates, that preserves profit margins, and that dramatically reduces inputs. So I want to thank, again, Brooke Rollins, Secretary of USDA, for making this happen, for her commitment to making America healthy again. And I'm going to introduce my partner and friend, Mehmet Oz.
They are too humble to say it themselves, but Brooke Rollins and Bobby Kennedy are amongst the 2 most innovative secretaries in modern history, and it is your leadership that makes what you're hearing today possible and feasible for people like me who run agencies to actually march forward to accomplish the kinds of goals that they're outlining. Let me give you 2 major examples of how this is playing out right now. The first is the Rural Health Transformation Fund, which, as many of you have been following, received grants from all 50 states, requests for grants for all 50 states. We have just started to get the scores back from grading these applications, which are done by outside experts, and we will allot all that money by the 31st of this month. One of the ways that you get the money is by applying for SNAP waivers. If you apply for a SNAP waiver, and as the 6 documents here that were signed by Secretary Rollins today would attest, there's a lot of interest in this. You get paid extra money. If you actually get your legislator to ratify these agreements, you get additional money. Now, we've also asked states to submit proposals for participating in the presidential fitness challenge, something that Secretary Kennedy's uncle created. And they get points for doing that as well. They also get points, by the way, for opening up credentialing so that rural communities can take advantage of clinicians that might live across the state border that might be closer to where they happen to be in the little corner edge of their state than from the big city in the middle part of their state. So our intent is to provide better health care across the board, and that Rural Health Transformation Fund is going to put a 50% increase in federal and Medicaid dollars into rural health care over the current standard for the next 5 years in a row. That's, again, 50% more money, $50 billion every year spread out over 5 years. Second big issue is to build demand. As regenerative farming and other tools are coming to the forefront and better, higher quality foods are quantitated with the plans that Secretary Kennedy is pushing forward with the dietary guidelines, we want to make sure there's a voracious appetite, metaphorically and in reality, for these tasty and nutritious foods. And eating those foods makes you healthier and will save the taxpayers money because Medicare and Medicaid won't have to pay out so much in healthcare claims. You either pay for it in food or you pay for it in healthcare expenses. We therefore are pushing both in Medicaid and Medicare for clinicians to talk in their annual wellness visits with with kids if they're pediatricians and with adults if they're primary care providers and general practitioners. And they get points, they get bonuses if they have these conversations teaching about healthy food. But it's even more provocative, I believe, now is we have the ability to incentivize plans like Medicare Advantage plans, which cover 34 million Americans, to provide in the supplemental benefits that they give for chronically ill patients, which is now 34% of all beneficiaries. That's a doubling since last year. But they can't just give any food. They must give food that is nutritiously valuable to these chronic illnesses for the third of Americans who get them, and they have to meet the dietary guidelines, which will be released next year. So it allows us now to enhance the ability of purchasing, the U.S. government's purchasing power and insurance companies' purchasing power to support the changes that are being made by the Secretary of Agriculture. Brooke.
Thank you, Dr. Oz. We've asked one of our farmers, Blake Alexander of California, a former state 4-H and FFA officer and a multi-generational farmer. Blake, it's so great to have you. Just a couple of words from you. Alfalfa hay and dairy farmer, great to have you here. Thank you.
Well, thank you very much. It's a true honor to be here. And our farm, Alexander Family Farm, was the first certified regenerative farm in the United States. And since that happened, I've kind of carried this load on my shoulders to attempt to help spread the message across the country to conventional farmers, organic farmers alike. And I'm just going to simply say that regenerative farming is simply farming in harmony with nature, with the way that God intended or our Maker intended. It's paying attention to the biology and building nutrient density in the soil, the plants, the crops that our animals eat. For us, it's chickens and cows, and then ultimately it's the milk and the nutrient density for food for humans, and making our planet a better place. In harmony with nature means that we're cleaning up the water supply on our farm. We're cleaning up the erosion that may or may not happen with both soil and water. And we're cleaning up the air, and so everybody benefits. All the wildlife, the ecosystem benefits, and ultimately we're sequestering carbon and literally doing the right thing and moving forward in harmony with nature again, making our planet a healthier place for everyone. We all breathe the same air.
Thank you, Blake. In 1 minute, Aubrey, our chief, anything that I missed on the regenerative piece that if you want to share with anyone as a farmer yourself?
First of all, thank you again for your incredible leadership in moving this forward in a way that puts farmers at the center of this. This pilot is designed by farmers for farmers to incorporate that feedback from farmers, because farming in California and farming in Indiana are two different things, but this program is designed to utilize the NRCS suites of practices that our farmers know and trust, and allows them that flexibility to as the Secretary talked about, I'm going to say on-ramp into regenerative practices and incorporate that in a measurable way. And more importantly, and I think, Secretary, you covered it so well, it connects the producer and the work that they're doing on the farm, granting them the credit for that voluntary action of change of practice on their farm that then can transition into the supply chain, into the marketplace, and directly back to the consumer. This country is 6 generations separate from the land. And this is an opportunity for us to bridge that gap together. And again, by looking at this holistically from on-farm planning all the way through the supply chain to the consumer. And so we're looking forward to rolling out this program in a way that farmers know, can trust, working with the NRCS offices and staff across the country in almost every county of the country to provide that technical and financial assistance to them. And again, ensure that they are credited back and seen as the solution and not the problem. So thank you so much.
Aubrey, thank you. And our great Undersecretary Richard Fordyce has joined us as well. All right, we'll take any questions.
First up is Mike Pearson.
Mike Pearson,
Please state your name and outline.
Farm Progress.
Farm Progress.
There you are.
Secretary Rollins, can you tell us what kind of criteria the NRCS will be using to assess these regenerative pilot projects?
Yes, I'll let Aubrey answer all the specifics. She's been a warrior on this and worked on it for months and months.
The criteria is the same as it has and always been. It's EQIP and CSP. These are our standing programs that take year-round applications. There's nothing new. It'll be the same application that our farmers know already. The difference is they'll be able to apply for multiple practice on a single application. What's important about that is it ties back to that whole farm plan. The idea being that we're going to look at all of the resource concerns on the property at one time instead of drive-by conservation, where we're only looking at maybe soil health here and maybe in a few years we're going to look at water management. No, it's going to come back to a plan. Let's start working the plan with the farmer. This means we've got to put our NRCS staff back out in the field where the farmer, where they belong. And we're making incredible efforts and investment in that as well. The Secretary has been a tremendous champion of that. But this is the same EQIP and CSP rolling contracts as we have all throughout the year.
Thank you. Yes, sir.
Hi, I'm Mark Heller at EAD News.
Yes.
Madam Secretary, I think I heard you mention urban agriculture and also technical assistance. Maybe you could expand a little bit on that. I don't think those are two things that the Office of Management and Budget really loves, but will the budget request protect them?
I'll let Aubrey kind of speak a little bit to that, but clearly the urban part of this is important to this administration, understanding how we're realigning to ensure that the priorities and that we're focusing on what's important. But there is no doubt that those who are most affected by inability to have access to nutritious foods, the dietary guidelines, let me say this, and then Aubrey, I'll let you answer the specifics. The dietary guidelines, this whole effort on making America healthy again, working on the SNAP, I'm thinking we now have 18 states, we've signed waivers, more coming by the day, the innovation that's happening. This is for all of America, but those that it will affect and benefit the most are those who are living in vulnerable communities in urban areas around this country and in vulnerable communities in the rural America as well. So making sure that we are building a system and an infrastructure that supports that as we're moving forward. USDA spends $400 million a day on 16 nutrition programs just across USDA, $400 million a day. You marry that to the new dietary guidelines, you marry that to these new programs, and all of government approach with a vision to make America healthy again, and certainly a focus in our urban areas is really important.